My name is Kristen Rodriguez. This is for Professor Tovar's Adult Health 2 Module 3 assignment. I've decided to do my assignment on GERD, which is also known as gastroesophageal reflux disease. In a normal stomach, you will have your stomach and your esophagus, and in between you'll have your lower esophageal sphincter, which is closed unless you're eating, and it'll open up to allow food to enter, and then it closes back up again, sealing it shut so that when your stomach is digesting the food, all the acid stays contained. Well, when you have GERD, your LES does not work properly, and so you'll have a backflow of acid that goes up into the esophagus and it causes heartburn. And that is the most common symptom that people who have GERD experience. There are those rare people that have what's called silent reflux, where they don't feel it at all. And that can be pretty dangerous because if you don't know you're having acid reflux, you have acid coming up there, it can cause damage to your esophagus and you don't know and you're not treating it. Some ways to diagnose GERD is you would go to your primary care provider and you would do a physical examination. They would ask about your history and signs and symptoms, and they can diagnose it on the spot, or they can send you to do an upper endoscopy. They will put you, they'll sedate you. Sometimes it's a twilight sleep, sometimes they'll completely knock you out. And then they'll put a camera down through your esophagus and into your stomach, and they will biopsy various parts of your stomach and your esophagus, and they will send those to the lab, and they're looking for specific things like Barrett's esophagus. They will also test you usually for H. pylori to see if that is present as well. Clinical manifestations of GERD. Obviously, the most common symptom is heartburn. And then you also have nausea, chest pain. Some people have difficulty swallowing or pain when they swallow. They develop a chronic cough or a hoarse voice, and some people have bad breath. When working with a patient that has GERD, we're going to want to encourage them to eat small, frequent meals that have high calorie and are high in protein. We want them to avoid certain foods and drinks. We want them to avoid very acidic foods like tomatoes, some citrus like fruits, lemonade, that kind of stuff. And then we also want them to avoid coffee and alcohol. Also, they should definitely quit smoking if that is something that they currently do. And then treatment for GERD. So for GERD, you do have a couple of options for treatment. There are over-the-counter medications that you can take. If your GERD is mild, you're just getting heartburn here and there, and it's really not affecting your everyday life, you can take an antacid like Tums. If you're noticing that it's becoming more frequent and you're needing something on a daily basis, you can take the AH2 receptor blocker like Pepcid AC, and that helps to lower the amount of acid that your stomach makes. There are also options like ranitidine. It's also known as Zantac, but that one was pulled from shelves for a little while because it contained a carcinogen in it, and they were able to link cancer to it. Thankfully, it is back on the shelves and it's available again, and it is definitely a safe option. For more serious conditions, well, GERD, more serious GERD, you can do a PPI, which is a proton pump inhibitor. One example of this would be Prilosec. You can get this over the counter. However, when you go to your doctor, they can prescribe you a higher dose. And this is used to lower to reduce the amount of acid that your stomach makes, just like an H2 receptor blocker. But it is stronger and it helps in healing your esophageal lining. So this is the best option for some patients when they have a really serious case of GERD. A nursing diagnosis for our patient would be imbalanced nutrition related to reduced food intake secondary to GERD, as evidenced by weight loss, heartburn, vomiting, loss of appetite, dysphagia, and loss of muscle mass. And then the desired outcome would be weight within normal limits for age and height. With GERD, you do have obese patients. You also have patients that are underweight that can't eat. So depending on the patient's needs, we would want to get them into that range of a healthy weight. Also, we'd want to identify nutritional requirements. Maybe get a food diary from them, find out what are they eating? What are they lacking in their diet? How can we add those foods in without making the GERD more symptomatic? And then we could do a daily weight chart and a food chart and just discuss the long-term and short-term goals that we have with the patient related to GERD. And then go ahead and refer them to a dietitian so that they can get really personalized care in regards to their nutrition and their dietary intake. When providing the patient with education, we would want to talk to them about some dietary triggers for GERD. Like we talked about earlier, citrus fruits and juices, tomatoes, tomato sauce. In addition to those high-fat foods like French fries, fast food in general, mint, we are talking about coffee, onions, soda. Those are all trigger foods for GERD. And then in addition, there are some other conditions that can be related to GERD. A lot of times people that have GERD also experience anxiety. Another thing is pregnancy can often bring GERD. And then when they have the baby, it sometimes goes away, sometimes it stays. Asthma and GERD also have a connection, as well as IBS and GERD. And, we'll want to talk about the different things that they can do to help reduce their risk of having heartburn. And some of those things include eating smaller meals, also staying in an upright position after eating for at least like an hour or two. Don't lay down right after you eat. It just makes the heartburn worse, unfortunately. Also, another option would be to lay on your left side instead of your right side, and that will also help with acid reflux.